Heroes of the pandemic could be receiving bonus pay as Minnesota state lawmakers set aside millions of dollars to split among frontline workers.
Reg Chapman explains what exactly essential workers want from this deal.
For more than 18 months, frontline workers risked their own health and safety to provide critical services to Minnesotans. Nurses, correctional workers, food service workers, and others are asking for a fair share of a $250 million direct support to essential workers.
And we're here to make sure that workers are heard when we say it's time to make it right.
ICU nurse and head of Minnesota Nurses Association Mary Turner says premium pay is what's due when workers go above and beyond the sacrifice to keep us safe.
Throughout this pandemic, workers have fought for protection, for testing, for our pay and our benefits too. Every time we were exposed, we had to quarantine at home. And many of us did not have benefits to pay for that, so we went short.
During its first hybrid hearing, the Frontline Workers Pay Working Group heard from essential workers about how they worked without concern for themselves during the COVID shutdown when others worked from home.
To get some help out to these folks that have worked so hard over the pandemic.
This group of lawmakers has their work cut out for them. They must first decide how many Minnesotans are considered essential workers and how the funds will be distributed. There will be lots of diving into definitions and data before the working group's September 6th deadline to send legislative language and recommendations to the governor.
It's critical, though, that the working group responsible for distributing the funds ensure that they are distributed in a timely fashion and are easy for the workers to access.
That working group will consider factors like workers' increased financial burden and increased risk of virus exposure.
To be passed successfully, 7 of the 9 members must approve the recommendation. Up next on Valley News Live at 6, having trouble paying rent because of the pandemic, what's offered in the state to provide help.